This video is meant to demonstrate and explain the purpose of a Jackson-Pratt drain. Jackson-Pratt tube is an active closed drain system that is used to establish a drainage route that will remove unwanted fluids or air from a surgical incision or wound. This prevents wound breakdown and promotes healing while limiting the exposure of contaminated fluids to the staff like us and other patients. The fenestrated tubing, as demonstrated here, is placed into the deepest portion of the wound or where they believe fluid will accumulate. Negative pressure is created with the drain to establish a gradient which will pull fluid and area from the area of interest. In order for it to function properly, there must be constant negative pressure. Some abdominal surgeries may require a drain. So assuming the drain has already been placed, I'm now going to demonstrate how to properly secure it to the patient. So the materials you're going to need for this are gloves. You're going to wash your hands as a sterile procedure. You're going to need final prep, alcohol, Teflon pads, and gauze pads with V-slits. You're also going to need cling wrap, vet wrap, and tape. So now that we've washed our hands, I'm going to put on my gloves here. And what I'm going to do is I'm going to use the final prep, which is here, they have it as iodine. And I'm going to put it on the gauze, and then I'm going to clean the wound from clean to dirty. So the cleanest part is going to be at the incision here. So I'm going to wipe here, going around, and you would do this 3 times. So I do that one. And then now I'm just going to clean the rest of the area around it. So now that that has done, I'm going to take another gauze and I'm going to put alcohol in it, and I'm only going to use this to clean the line itself. So I'm going to hold the line, and I'm going to put it around, and I'm going to use it just to clean it, and I'm going to gently squeeze to dislodge if there's any clots there. So once that's done, I have the Teflon and the gauze pads. So the Teflon is going to come first because it's going to be non-adherent to the wound. So what I have already done is I pre-made some V-slits in it. So what are we doing? I'm going to open this here. And then making sure not to touch the entire dressing, I'm going to use the corners. And I'm going to secure it, one going up. And then I'm going to take another one, using the same principles, and this time I'm going to do it so it's going downwards. This just helps with securing the drain as well. And then just in case for any other fluid leakage, I'm going to put some gauze on, and it's going to go the opposite way. So this one's going to go horizontally. And then depending on preference, some people like to have the drain inside looped around, or on the outside, but for our purposes, we're going to keep it on the inside. So what I'm going to do is I'm using a plane, and I'm just going to wrap the patient. I'm going to have Jasmine come and restrain the patient. She's going to help hold the patient while I wrap it. So now that I've done that, I'm going to loop it, ensuring the drain is right side up. And I'm going to loop it, making sure there's no kinks in it. And then I'm going to wrap it again with the gauze. This just helps keep the drain out of the way when the patients walk in, so they don't hit it or they don't dislodge it. For the top layer, I'm going to use vet wrap. And then as you wrap, you always want to make sure it's not too tight. So as you can see, I'm pulling it away from the actual gauze itself before I wrap it. And just to make sure that the patient is able to have blood flow and it's not too restrictive. And then finally, I'm going to take a piece of tape and I'm going to cancer ribbon it just so it has extra support. And now I'm going to pass it on to Jasmine, and she will show you the maintenance of the drain.
Now I'm going to show you how to maintain the drain after it has been cleaned. So this is my good buddy Samuel. I just want to make sure that he's nice and cleaned up, make sure that his drain is working properly, and that the negative pressure function is still working. Yeah, so as I said, the first thing that we're going to do is make sure that the dressing is nice and clean, that nothing has leaked out, and so far that looks really good. So then we're going to remove this cancer ribbon that Carrie has placed to be able to remove part of the vet wrap to see what's going on underneath. So once we have checked that everything's nice and clean, and we want to check the line that's underneath the wrap to make sure that there's no clots and that it's all still flowing nicely. So my assistant Carrie is going to restrain my patient so then I can remove his bandaging well. Alright, so we can see that it's nice and clean. There's nothing leaking out of it. Everything's still nice and intact. There's no clots in it, which is very good because you don't want that because that'll have the drain not work anymore. For demonstrative purposes, we're going to use this bulb here that has liquid in it so that you can see the process of draining it. So then we're going to remove this little plug and we're going to gently, making sure not to, break the bulb or anything, we're going to gently press the bulb to remove the fluid from our drain. Now before we place this back into it, we want to make sure that it's nice and sterile and clean. So we're going to use some of our chlorhexidine soap, and we're going to give this just a little wipe. And then we're going to take a little bit of alcohol also on the plug, just to make sure that it's nice and clean, all set and ready to go. And then very carefully, without touching the little nugget there, we're going to place it back inside. But before we do that, we're going to squeeze the bulb to get rid of the negative, to create negative pressure. And then we're going to push this little notch back inside. Just like that. And then at this point, our bulb should look nice and empty, squished in, ready to suck out more fluid. And now we're going to loop it back into our patient so we can. So now that it is looped back in nice, I'm going to gently rotate this so you can see it. It's looped around, no kinks in our line. We're going to get it all wrapped back in here. And then we're going to place another layer. We're going to place that wrap on the outside to make sure everything's nice and compact and it's all in there and secure. Now that that is done, we're also going to grab another piece of tape. It is super sticky. And we're going to make another cancer ribbon on here to ensure that the drain does not move. And we're going to continue with the quantifying portion of our lovely fluid. So you want to make sure that you're emptying your bulb every 6 hours or when it is half full. You do always want to ensure that there is negative pressure in the chamber, because if there's not, then it's not doing its job. So nice and squeezed in, ready to go. You can always estimate the quantifying on it with the nines that are on the bulb, but that's not always accurate. So the best way to do it is to drain it into a secondary dish and using a syringe, draw up the fluid. So as we can see, Samuel has drained about 17 mils of fluid. So that you would write in their patient chart or in the medical history to make sure you keep track of it. Also note the color, the consistency, what kind of exudate it is, whether it's serous or purulent or sanguineous. Make sure you always note that so you know what you're watching for. Another really important thing that we need to know when taking care of a drain is we need to know when the drain needs to be removed. So this can happen either when the production of outflow in your drain is less than about a milliliter per kilogram per 24 hours, or when you notice that the amount of fluid that is being excreted is noticeably less and less and less. So to remove our drain, we want to remove our cancer ribbon. We're going to remove all of the layers. We're going to remove all of the gauze pieces that have been placed in here. And then lastly, what you want to do before you take it out is you want to clean any of the nasty debris that'll be right around the incision site or where the drain enters the body. So using some chlorhexidine soap and a little bit of water, we're going to scrub from clean to dirty always to make sure that all of the nasty crusties are gone out of there. We could also use some warm soapy water. The warmth will also help break that up. Another thing that you can also do is take a little bit of alcohol just to get on the tube itself and just gently cleaning it with alcohol to make it just a little cleaner. And then we're going to want to remove our sutures that are holding it in place. And then for demonstrative purposes, I'm going to use this tube to show you how to remove it. So in one motion, you want to firmly grasp the tube that is holding it in place and have somebody else restraining your patient. Make sure they're sedated for this portion because it might hurt. In one motion, we're going to pull the drain straight out of the body. Once the drain is removed, we're going to want to bandage our patient for at least 3 to 5 days after removal so everything can be nice and healed and it can just relax. We're gonna grab a Telfa pad to place over top of the incision hole so that if any debris or anything or discharge comes out, it won't adhere to the wound. It'll be nicer for removing it in a few days. So we'll take our Telfa pad out, making sure to always grab it at the corners because you want to make sure the inside is always nice and clean. We're going to place it over top of where our incision site would have been, and then we're going to wrap around gently again with some stretchy gauze and then followed by some vet wrap to ensure that it all stays in place. You want to make sure that it's not too tight so that our patient can breathe and that everybody is nice and content. And this is how we perform the care and maintenance of a Jackson-Pratt drain at Sheridan College. Thank you, team members, for watching.
So here we have Fluffy number 1.
His name is Samuel.
It's Samuel.
Enjoy, Kelsey. Thanks for a great semester.